So this is for real Bharat, not for India, I'm sorry. This is for real Bharat. After doing THR, can we allow our patients to go to Pandit ji to Mandir, Maulvi to Masjid, Sardar ji to Gurudwara, or Indian traditional dinner, yoga, or Indian toilet? I think answer is no. So that's why every time we are counseling with our patient regarding THR, patient is to ask, sir, हम चुक्का मुक्के बैठ लेंगे ना, पालथी मार लेंगे ना, and we used to scratch our head. So we have to think out of box. We are not doing justice to our patients. So to do justice, we have to think. Allow our patients to sit cross-legged, squat, hyperextend, and hyperflex. Now the question is how to do it. Do anterolateral approach. 360-degree exposure of acetabulum is as usual. Acetabular cup placement in 15-degree anteversion or little bit more. Never neutral or retroversion. Cup inclination 45-degree or some more horizontal. Liner with posterior superior extra coverage is very advantageous. Femoral head and stem size should be according to optimum tensioning of the soft tissue. No loose soft tissue should be there around hip. Tight repair of capsule and abductor is must. Post-op protocol, partial weight bearing after 2 weeks, hip exercise after 3 weeks. Emphasis on hip abductor is very encouraging. After 6 weeks, aggressive hip range of movement and full movement by 3 months. Complications, dislocation, very rare. Since it is anterolateral approach, dislocation is so very rare. But in this case, we have faced dislocation because this was fourth surgery and soft tissue tension was very poor in this elderly lady. Periprosthetic fracture, it occurs in enthusiastic old age patients. Limb discrepancy again rare because the patient is in lateral position. Kinematics inside body, doubt we all have that by doing squatting and Buddha position, there will be early wear and tear of liner. No. Since thickness of head and liner is all around similar whole sphere, so there is no chance of early wear and tear. Maximum joint reaction force on hip is about at 90-degree, which we usually allow in any THR. At hip flexion more than 90-degree, the force is set at knee. So there is no chances of early wear and tear. Kinematics inside C2. See single THR, see the movement. How the patient is squatting, sitting cross-legged, so smoothly, ball is moving inside acetabulum. No chance of dislocation is there, no chance of protuberance is there. Same thing in bilateral THR. How smoothly cup is playing inside acetabulum, while patient is sitting cross-legged, squatting. See how swiftly. Here I am going to share some of my cases. Real Bharat patients. 35 years male, grade 4 OA, bilateral THR after 6-week interval. See, movement. Indian patient have to do it. My next case, bony ankylosis of left hip. There was marital issue here. She was not able to conceive after 3 years of marriage. After 8 months of post-op surgery, patient conceived. See the baby inside pelvis. Baby skeleton is there. And see the movement. Again, bilateral OA, female, 35 years, bilateral THR. See the movement. 3-month-old female femoral head fracture dislocation. Conservative treatment was given. Again, one female had to sit cross-leg. 7 centimeter shortening, a female. Their in-laws had rejected her to stay. She was at the verge of divorce because she was not able to do normal duty at their in-laws' house. Femoral head slipped at lesser trochanter with migration of proximal femur so high. Initially, tenotomy done and a skeletal traction applied for 3 days. Now, only 2 centimeter shortening is there, and see the lady. (16 years male, 2 years old non-union, arthritic hip. See the movement of boy. She is doing all activity as a normal boy. Protegia stimuli, 49 years. See the movement. This man, (16 years male, fractured neck femur, neglected. He was advocate. See, wrongly it has mentioned 9 months, it is 2 months post-op simply. And this Vakil Sahab, after 2 months of surgery. Again, arthritic knee. See the boy. (56 years, fracture dislocation hip, complex primary THR, first posterior wall and THR at same sitting. See the lady. Lady from village side. She sits, she does everything. Dadima, very old lady, simple PH, partial. So we have to think. Tailor the coat as per body. Give what is asked for, not what you are having. To achieve this, keep the hip cup in anteversion. Optimum soft tissue tension, post-op follow-up is must. Check during surgery by flexing the hip more than 130 degree and give thrust over knee. See the implant processes, whether it is dislocating, it will not dislocate. Have faith and allow the activities of daily living. This will give you and your patient both very satisfaction. Thank you. Jai Bharat. Question?
Thank you for this informative speech, sir. I would like